Good morning, everybody. It is 1:30, 2019, about 1:30 p.m. And I wanted to do a quick medical discussion again. And one of the topics I picked would be, how about if you were the assigned field medic for your group? And what type of injuries would you see out in the field? So I picked the ones I thought we would deal with. The most common, I think, would be, due to slips and falls, would be your sprains, ankles, to the ankles, sprained knees, and wrists. The big thing is a lot of that is preventable because there's stuff we can do for ourselves to protect ourselves. Buying good high boots and wearing good socks are just some of the things that we can do. Treating an ankle would be one. If you had to, I would take the boot or shoe off and then examine the injury. What you're going to look for is any blue, purple, or colorization at the site, or look for a dislocation where the bones would be not aligned right. And the way I do that is sometimes you got to take the good foot or leg and look at that and compare it. So that way you can see the two extremities side by side. With sprains, a lot of times you may see a dislocation with the ankles, but more likely it's going to be a fracture when we're dealing with that type of stuff. That's in the ankle area. If I needed to make a splint, I would use 2 sticks, a piece of rope to minimize any movement, or whatever other stuff you would have, SAM splints, Co-band, cling, to make that immobilization possible. And that would be for your ankle and knee areas. We make that type of splint. Keeping the leg straight out may be difficult for some people to walk, but with support or a homemade crutch, they may be able to walk. If it was a knee, I'd use 2 sticks on both sides of your kneecap and immobilize it that way. But the biggest thing is don't make it too tight that they can't flex their leg if it starts to swell. Yes, you want it tight, but the big thing is when it starts to swell, if you wrap it too tight, that gauze isn't going to allow it to expand, which would be bad. It would cause cut off of circulation. So we want to be careful of that. Temperature-related conditions, I think, are a big one. For those that are in the Prepper X community, you've seen where they talked about in the summer how hot it got when they were at a location, and some people were having heat issues. And this is where heat or cold, you got to be careful. Like right now here in PA, we have wind chill's going to be negative 20 tonight or today. Out in Minnesota, Michigan area, they were calling for wind chills of negative 40 to 50. So you want to be very careful and be prepared if you had to go out in those environments. Hypothermia, the biggest thing you can do is try not to sweat. Because if you sweat, that causes wetness to your clothing, which can then cause, if you get air into that area, it will cause you to start shivering. Symptoms of hypothermia would be loss of consciousness or drifting off, sort of like nodding off, not making sense, disorientation, fingers and toes getting really cold are just some of those. But now realize some other conditions may affect that. Like me, with the diabetic side, even though I'm not insulin dependent, my fingers now, I feel it more when I'm out in the cold. Plus, I've started dropping weight. That could all be associated with it. Plus, some of the medications sometimes will have those effect on circulation issues. Treatment. One of the things they say is to do a huddle. Start warming them up. Try not to rub them roughly to try to warm up their skin. Sometimes getting them out of the environment, getting them into a warm environment, and then get all that wet clothing off them. And then gradually getting them back up to temperature with new clothing and stuff like that. If you're out in the wilderness, then of course you're going to need to do the huddle method with other people. Try to build a fire, get the fire started, and build an insulated area for them, and use body heat to keep them warm. Build a quick lean-to, emergency blankets. Take off their wet clothing if you have other clothing that they can wear, just to prevent anything like that from happening. Another one that you may see is dehydration, heat-related. Some symptoms of that would be walking slowly, becoming sluggish, becoming white or pale in color. A lot of times they start getting cramps, and sometimes they may pass out. The treatment for that is strip them of all clothing, give them something cold, or to drink. But I prefer to use like a room temperature type beverage, and only let them sip it, because if they guzzle it, they have a tendency of wanting to throw up. Also, what I would do is take ice packs or bagged ice if I had them with me. I'd put them in the groin, neck, and armpit regions, like the under here, the back of the neck, in the groin, and also behind the knees. That'll also help lower their body temperature if it's very high. Have someone fan them if possible. If need be, build a sun shelter, a tarp or something, so that the sun's not beating on them. That may help lower the temperature around them at that point. And like I said, give them water slowly. Fractures, the biggest thing there. You're able to move it a lot of times on the extremities, but won't be able to move it normally. And the same treatment as a sprain, not to tie it too tight, is what we would do for that. Remember ABCs: airway, no obstruction, breathing at least 10 to 12 times per minute, circulation, that means they have a pulse. At least one of these is what you need to be considered alive. So if you don't have any of these, then you're considered dead, which we can treat that with CPR, but in a wilderness setting, is that possible? Bugs, snake bites, red over yellow, you're a dead fellow. Red over black, you're okay, Jack. Get snake guards or leg guards. Try to determine if it's venomous snake. Some people are like, how do you do that? Normally, they say if you look at the snake, the eyes will determine that. If they have cat eyes, it's normally going to be poisonous. If you look at the bite mark, you'll either see fang marks, normally with a venomous snake, or the non-venomous snakes will have a full arc of teeth mark. That would be possibly non-venomous at that point. The other thing we can do is slow down the blood flow. You don't want their heart racing and everything else. And then tie about 5. They say sometimes with certain snakes. Now here in PA we don't do it, but I know sometimes with like your coral snakes, they say about putting a constricting band on the arm or the extremity where they're bit to slow down the venom. Not very familiar with it because we don't have them here. So I tell people you got to be aware of that. The biggest thing with venom, it breaks down the tissue. Venom enters the blood flow, travels to the heart, and then breaks down the tissue of the heart. That's what we're looking at when that happens. First aid tools and supplies. Treat quick and fast would be tourniquet, gauze, antibiotics like Neosporin, tweezers, quick clot, a needle, if you know how to do it and you're trained in it, how to decompress chest, and shears or scissors. Starting CPR before it's needed is one of the common mistakes. With CPR, it's important for hand placement, and you could potentially harm someone's spleen or gallbladder if your hands aren't properly positioned. So that's some of the common mistakes you may see if people are doing CPR. So you want to be careful of that. Shock. Some of the symptoms: shaking uncontrollably, bodies trying to fight back, not making sense. Treatment: wrap them up, worry about their airway, put them in their recovery position. Don't know if I discussed that in any of my other videos, but you would put them on their left side, cover them. So the reason we use left side is because there's 3 lobes in the right lung, 2 lobes in the left, and the way the heart is positioned. Plus, if they go to throw up, all fluids will come out of their mouth. So you want to be prepared for that. If they're going into shock very fast, we try to keep them engaged, especially like if somebody's shot, we try to keep them in the fight, talk to them, keep them engaged, because if they're engaged, they may hold on a little longer. When we don't do that, sometimes that becomes an issue. Just quick review: bleeding, direct pressure, elevation above the heart forces the blood to slow. Tourniquet, only on extremities, 2 to 3 inches above the area, or high and tight depending on what's going on and if you can see. And the important part is for you to stay calm. And then remember, one of the things you can remember the most is run out of blood or run out of bleeding and you're dead. That's an important thing to remember. If we can't correct those issues, they can die. So you want to be prepared for that. So that was my little video today. I'm going to sign off here. If you have any questions, let me know. As always, hopefully you learned something today, and always better to be prepared for the next adventure in life. Till the next time, be safe. God bless. Rescue Boss signing off.